Hello, my name is Dr. Julie Wickel, and I'm a veterinarian here at Claws and Paws Veterinary Hospital in Pearland, Texas. With me today we have Betty. Today we're going to talk about chronic or recurrent ear infections. Ear infections make up one of the leading causes of visits to veterinarians. Infection or inflammation of the outer ear canal is called otitis externa, and this is the most common type of ear infection seen. A less common but more severe condition is called otitis interna, infection of the inner ear canal. Inner ear infections take longer and are more difficult to clear up. Now, the majority of the time, when you bring your baby in for an ear infection, it's going to clear up and more likely not come back. Today's talk is not going to focus on that, but instead we're going to talk about those difficult to heal or resolve ear infections. Common causes of ear infections are ear mites, bacteria, and or yeast. Now the ear is a natural incubator. It is dark, warm, damp, and moist with very little airflow. Ear mites are the most common cause of ear infections in kittens and outdoor cats. Puppies can get them too. Actually, any pet can get ear mites. But ear mites are microscopic, meaning they are not visible to the naked eye. What you see is a brownish black coffee ground discharge in the ear and occasionally little white colonies moving around. Ear mites often lead to a secondary bacterial or yeast infection. Ear mites can be contagious to dogs, cats, ferrets, and rabbits. If one pet gets ear mites, then everyone in the household needs to be treated. There are numerous products available today for treatment of ear mites. If ferrets and rabbits are treated, you need to make sure that you are treating them with a veterinary-approved product for that pet. Contrary to popular belief, most ear infections in dogs and cats are not due to ear mites. Many ear infections or inflammation are due to allergies, which is a big component, skin conditions, which are hereditary in some breeds, trauma, tumors, and foreign bodies. Dogs tend to get ear infections more often than cats. Ear conformation, the shape of the ear, also plays a big role in susceptibility to infection. As you can see here, the ear canal in dogs and cats has both a vertical and a horizontal canal. The canals are in the shape of an L. This means that earwax, dead skin cells, and secretions have to work their way up and not simply straight out. Accumulation of this debris, along with the warmth and humidity, cause overgrowth of bacteria and yeast that normally live in the ear canal. Here you can see the model of a normal ear. The ear canal is nice and wide open. This is the eardrum, the inner ear, the fossicles, and here on this side you can see a diseased ear. A lot of times what you'll see at home is the redness, inflammation, and wax. As you can see, with a chronic ear infection, that causes changes in the ear. And see how narrow this ear canal is and how we have some debris down here. The ear infection can even penetrate or rupture the eardrum and go into what's called the bulla, the middle ear. Some breeds tend to have ear problems more often than other dogs. Cocker Spaniels tend to produce more wax than do other breeds. Overproduction of wax leads to irritation and moisture in the ear. Poodles and Schnauzers have more hair growth, which traps moisture deep in the canal. Shar-Peis tend to have narrowed ear canals, which restricts airflow. Other breeds, such as Bloodhounds and Basset Hounds, have large, heavy, floppy ears, which do not allow air to dry the ears. However, any dog or cat can develop ear infections. Signs of ear infection and inflammation. At first, you may notice that the ear is red and inflamed, and your pet may shake his head or scratch at his ear more often because of discomfort. A bad odor is usually noticed, and your pet may be tender or irritable when the ear is touched. A black, brown, bloody, green, or yellowish discharge may occur. Some dogs and cats can be extremely painful with ear infections. Some may show no signs at all or may show a reluctance to eat and seem to be in pain when opening their mouth. Chronic ear infections lead to the ears appearing crusty or thickened with a cobblestoned appearance. The ear canals become narrowed and firm on palpation. Narrowed ear canals are another cause of chronic recurring ear infections because it makes it almost impossible for medication to reach that horizontal ear canal. Sometimes steroids can help this condition, but often aggressive surgery is eventually required. Long-standing or chronic recurring ear infections can also lead to what is called a cauliflower ear, and this is where the skin on the inside of the ear thickens and has a rough appearance. Infection that extends to the inner ear could result in a head tilt, loss of balance, rapid back and forth eye movements called nystagmus. Sometimes partial paralysis of that side of the face can occur, called Horner syndrome. This is where there's drooling from the side of the mouth, difficulty eating and dropping food, inability to blink, drooping of the eyelids, lips and nostrils on the affected side. They can have a prominent third eyelid and uneven pupils. If the eardrum ruptures, this can sometimes result in permanent loss of hearing. A common result from shaking the head and scratching the ears is for a blood vessel to burst in the ear flap. This causes swelling in the ear flap called an aural hematoma. This can be painful and sometimes needs surgical treatment to be resolved. The earlier that the infection is detected, the less pain your pet will experience and the easier it will be to treat. If you notice that your pet is experiencing any signs of an ear infection, don't automatically assume that it is ear mites and get something over the counter. Again, ear mites are usually not the problem, and the wrong treatment can lead to prolonged pain, potential hearing loss, and increased severity of the infection. Your veterinarian will examine your pet's ear with an otoscope, which lights up and magnifies the view of the ear canal. With this piece of equipment, the inside of the canal is visualized, foreign bodies, tumors, and polyps can be seen, and it also can be determined whether or not the eardrum is intact. If your pet is too painful or there's too much discharge in the ear, then your pet may need to be sedated for a thorough cleaning and examination. Part of the exam involves obtaining a sample of the discharge or debris present inside the ear canal for microscopic exam to determine what is causing the infection. Good girl. Good girl. This is important to enable your veterinarian to choose the best medication to treat the infection. If the infection is severe, recurrent, or involves the inner ear canal, then a test called a culture and sensitivity may need to be performed to identify the exact type of bacteria and be treated specifically. Treatment. Treatment is determined depending upon the cause of the infection, the type of infection, severity, and your ability to treat your pet's ears. Multiple topical medications and even oral medications such as anti-inflammatories, antifungals, or antibiotics may be needed. Treatment could be for only 2 weeks or it could last 2 to 4 months depending on the severity of the infection. It is necessary to have recheck examinations in order to check on the progress of treatment and make sure that the ear infection has resolved. If a foreign body, tumor, or polyp is present, then sedation and surgery will be needed. How to medicate clean the ears. Gently pull the ear flap up and towards the back of the body. Place the dispensing nozzle into the vertical ear canal and apply a liberal amount of ear medication into the canal. Hold the ear up for a little while to allow the medication time to slip down the vertical into the horizontal canal. Massage the ear canal with your thumb and finger below the base of the ear. You will hear a squishing noise that lets you know the medication is being distributed where it needs to go. If you do not hear that noise, then you need to reposition your fingers or apply a little bit more medication. Sometimes you will be instructed to apply a small amount of medication on the inside ear flap. In treating the ears, it is critical to follow your veterinarian's instructions. Do not treat only until the ears look and smell better. You need to treat for as long as you were instructed to. The majority of ear infections are easily treated. However, an important part of treatment is identifying the underlying cause of the disease. If this goes undiagnosed or untreated, then the response to treatment is not as good. Many dogs with chronic or recurrent ear infections have allergies, inhalant or to food, or other conditions such as hypothyroidism. If the ear infection is due to allergies, the current inflammation and infection can be cleared up, but you are looking at long-term ear cleaning and maintenance for control, not cure. Prevention. Some ear infections, like those secondary to allergies, are difficult to prevent. Avoid prolonged wetness of the ears. After bathing and swimming, apply Epiotic Advance to help dry the ears. This is safe and gentle enough to be able to be used daily. Besides drying the ears, this product also helps to break up wax. Ear cleaners will usually be sent home for maintenance and cleaning. Liberally but gently apply the cleaning agent and massage well. Too vigorous cleaning of an infected external ear canal can cause trauma to the eardrum and infection of the inner ear. Some ear cleaners are too irritating to the middle and inner ear. Some medications are inappropriate if the eardrum is ruptured. Your veterinarian will let you know which cleaner or medication is appropriate for this procedure. Do not use any cotton tips to clean the ears, as this could push wax and debris deeper into the ear. Your veterinarian will make recommendations concerning how often the ear should be cleaned. Usually once or twice weekly will suffice. Recurrent ear infections. Each time an infection occurs, it causes micro changes in the interior of the ear, makes it easier for future infections to occur. As I said, allergies are a common component in recurrent ear infections. Both inhalant allergies and food allergies can cause ear infections. Many pets with multiple allergies will have flare-ups of the eyes, ears, and skin all at the same time. Up to 25% of dogs with food allergies may have ear infections as their only clinical sign of disease. Your veterinarian may recommend blood work to look for underlying diseases that could be interfering with the body's immune system and its ability to fight off infection. In some cases, your pet may need to be sedated for a thorough ear cleaning, exam, visualization of the eardrum, to remove a polyp or foreign body, and to get a deep ear sample for additional testing, such as a culture and sensitivity. Skin allergy testing and/or a hypoallergenic food trial may also be recommended. If recurrent or chronic infection is due to the structure of the ear itself and the medication is not working, then surgery may be recommended as a last resort. In closing, the majority of ear infections are easily treated. However, many recurrent or chronic ear infections are due to an underlying cause, for example, allergies. If the ear infections are due to allergies, the current inflammation and infection can be cleared up, but you are looking at long-term ear cleaning and maintenance for control, not cure. When or if your pet has an ear infection, the physical exam is very important. Once your pet is responding to treatment, a follow-up exam is also important to make sure that the infection has cleared. You and your veterinarian and your baby together make up a team approach to treating chronic or recurrent ear infections. It is very important for you to follow treatment instructions closely and to let your veterinarian know if you are unable to do so, or if anything changes with your pet's diet, environment, or response to treatment. Communication is key. Please do not hesitate to talk with one of our friendly staff members should you have more questions on this topic or other topics. A handout concerning ear infections can be found on our website, www.cpvh.com. Thank you.